It's your girl Felicity. Hello and what's up guys, welcome back to my channel. It's me Felicity and thank you so much guys for tuning in. So leo tuko hapa Komarock Modern Healthcare. Of course guys, hivi kama mnaona the background, today is World Hypertension Day. It's on 17th May. That's why I'm here kwa hosi. And by the name of it, World Hypertension means blood pressure, yeah. So it's all about high blood pressure and all that. I'm sure maybe you guys have maybe a friend or a relative who has that condition, because it's usually somehow common. I'm here to maybe learn a few things about it with you guys, of course, about maybe the signs and symptoms, how it usually occurs, ndo ifike hiyo point ya kupata HBP, and also the treatment. So we are going to see Dr. David today. And apart from that guys, I was referred someone by a friend, and she's called Ann Wanjiru. She's about 90 years old, though hakai her age. She's great for her age, by the way. So she has HBP and also diabetes guys. So I'm here to take her through all that procedure. Kama kuna mashida zingine pia tambia daktari, and tutajua how to go about them. So guys, I hope you're ready for this video. It's going to be an interesting one, and I hope you guys learn a few things, yeah. And also kama uko na that condition, kama uko na high blood pressure, if you have diabetes, stick around, cause we are going to learn a lot. And also, you know guys, which is the best hospital. I would recommend you guys to come. And ukiwa na any condition, actually kama uko na ball guys, you know I gave birth nikiwa kwa hii hosi, nilideliver kwa hii hosi pia. I would also recommend that any condition actually guys, you're so welcome kuje Komarock Modern Healthcare and experience the good services. So guys, twendeni tupatane mbele. We meet Ann Wanjiru and also Dr. David na atatuelezea the rest. So stick around guys. So guys, as I told you, today is World Hypertension Day, and this is the lady I was telling you about, anaitwa Ann Wanjiru. She has HBP and also diabetes. Okay. So she's here for a checkup. Okay. Yeah. Okay. And maybe unaweza tuambia more about HBP since it's that day.
Okay, more about you mean was high blood pressure?
Yeah.
Okay. Has she passed through the triage or trying to remove her blood pressure for today?
Through?
I was trying to remove her blood pressure for today.
Okay.
Because we first have to know her blood pressure. And due to the fact she's a known patient with hypertension, we first have to know her blood pressure.
How is that done?
It is checked from the triage.
From the triage?
Yes.
Okay. So guys, tunaambiwa tuingie triage kwanza. Tunafaa kuangalia kwanza blood pressure yako inasomaje, alafu tutarudi kwa daktari ndio tujue what next. So, lekea ni patient wa HBP. kupima pressure inafaa kusoma the normal kind.
Yeah, there are times it's normal. She on medication.
Yeah.
The medication si lazima ikuwe juu. Can be normal.
Na ikiwa normal ndo ina range between what and what?
The around 60 to 100. They are found between 100 to 140.
Okay.
Yes, how are you? Okay. You start.
Yeah?
You start, you were talking.
Yeah, so
Okay.
as I was saying, she has high blood pressure.
Okay.
And vile amepima, I've been told by the nurse that her blood pressure is low.
Okay, yes.
So how does, I don't get it.
Okay. She has high blood pressure.
Yeah.
Or she was told by the nurse that her blood pressure is normal for today. Possibly because she's on medication. Is she on any medication for blood pressure?
Unakunywa sahi.
Is she on medication for blood pressure? So her blood pressure is okay for today because she's on medication for blood pressure. So possibly if she was not on medication for blood pressure, or if she was on, she's being given medication for blood pressure, but she's not complying with the treatment, then she's not taking the medication as expected, then possibly her blood pressure would have been high today. So when you say high blood pressure, we just mean, let me explain it in the easiest way where somebody can understand. High blood pressure. Let's break it down. High just means anything which is higher than normal, higher than expected. Blood pressure. Blood pressure is just the pressure of the blood exacted within the blood vessels. You understand me? So, when we say high blood pressure, we look at two values. We look at the one above and the one below. So the one above should not exceed 140. And the one below should not exceed 90. Yes. So the nurse said her BP is okay for today because the one above is at 137 and the one below is at 78. Yes. So there are so many risk factors for having high blood pressure. Basically, what causes high blood pressure is just how it is. It's just like increased force of contraction of the heart. When the heart contracts with a lot of force, it causes the blood pressure to shoot. Also, increased blood volume. Also, when the level of the blood in the body is so high, the blood volume is increased. It causes high blood pressure. And also, when the blood vessels also are blocked and narrowed, because there's what's called a blood vessel, and there's the space within the blood vessel called the lumen. So, if the blood vessel either contracts, squeezes, or the space within the blood vessel is narrowed, it can cause the blood pressure to go high because blood will struggle to pass through the blood vessel.
And is it related in any way with diabetes?
Yes, it is related with diabetes. Patients with diabetes, they have high blood sugar. So basically, when you hear a patient has diabetes just means high blood sugar. And you ask yourself, why is the sugar in blood high? Sugar in blood can be high because of so many reasons. There's what we call insulin. So insulin is a hormone being produced from the pancreas, from some group of cells in the pancreas called the beta cells. So the purpose of that insulin is supposed to shift or take the sugar from the blood into the tissues. So when a patient has diabetes, a lot of sugar accumulates in the blood. Thereby, it makes the blood to become very viscous and it increases the blood volume. In the process, it causes high blood pressure. But there's so many things that can also cause high blood pressure. Diabetes, even some patients they have a lot of fats in their body also. Some patients, their kidneys are not working properly. The purpose of the kidney is to maintain what we call fluid and electrolyte balance. So when the kidneys fail to work properly, that's why you see people who have kidney failure. You see them swelling. Do you know why they're swelling? Because a lot of water is accumulating in their body. So instead of that water to be removed and flushed out of their body by the kidney, it accumulates in their body. In the process, it causes their blood pressure to go high. Even patients with a lot of fats in their body also. When patients have a lot of fats in their body, it can also cause them to have high blood pressure. Because the fat goes and lodges in the blood vessel, in the hole in the blood vessel where blood is supposed to pass through, thereby narrowing it and causing blood to struggle to pass through, thereby increasing their blood pressure. Also, patients who, there's a gland called the adrenal gland. Adrenal glands are two glands on top of each kidney. So when the gland is not functioning properly, meaning the gland is producing a lot of the hormones which it is supposed to produce, it causes the blood pressure to also spike. There's also a gland in the neck called the thyroid gland also. if the gland also functions excessively, hyperfunctions. Hyper means above normal. It functions more than expected. It can cause blood pressure to also spike also. No stress can also cause high blood pressure. Because when you ask,
So how
Yes.
can we go about her case lately?
how can we go about her case?
Yeah.
Has she ever done any investigation?
Yeah, she already knew she has it.
Okay, okay. She already knew, because basically when the patient has high blood pressure, there are investigations which we do. Check your blood sugar, send you for a thyroid function test, we send you for what you call lipid profile. Lipid means fats. So lipid profile just to see the amount of fats in your body. Because if they are more than normal, it can cause your blood pressure to go up also. Then there are investigations we call ECG and echo. ECG is just an investigation to look at how the heart is functioning. And an echo is just an investigation to look at the structure of the heart. Because every organ in the body, you assess it in terms of structure and function. That's why sometimes you see them say liver function test, just to see how the liver is functioning. Then they start talking of an abdominal scan, just to look at the structure. So there's so many investigations which she's supposed to do. Well, I think I don't know if those investigations are done, or she's on medication. And from what I can see, her blood pressure is
It's okay.
well controlled. Yes. If you treat it, possibly the patient can become okay and might not necessarily need those medications for blood pressure. But when you don't know the cause, it's what we call essential hypertension. You don't know the cause. It's called primary or essential hypertension. You don't really know what is causing it. So you just be giving the patient medication just to control that blood pressure. So the problem with that is that the patient will continue taking medication for as long as possible. When you can find the cause, there's a high chance you can address the cause and the patient will stop taking this medication. Just like if somebody has malaria and has fever, you just be giving him paracetamol to control the fever. He will take paracetamol for as long as possible. But the day you find out what is causing that fever and you treat the malaria, you stop taking paracetamol.
So it's curable.
In some patients, it is curable. In some patients, it is not necessary. You just manage it. But some patients, it's curable. There are so many patients I've come in contact with who had high blood pressure, and I could trace the root cause. And when it was addressed, the patient stopped taking such.
So you can say for her it's diabetes.
For her, it's diabetes. I will not necessarily say what is she has. She might also have other risk factors. Because basically, what we call the diabetes is a risk factor for her. So she might have diabetes, which can possibly be the cause of her high blood pressure, and she might have others. But the diabetes was the body. But we're just talking about the diabetes because we know she is diabetic. But we've not done other tests to rule them out. You understand me? Just like someone saying, you see someone who has malaria and other infections. Then you see this patient has fever because they have malaria. But don't forget they have other infections. You understand me? So possibly it can be because of the diabetes only, or it can be because of the diabetes and others. But we only know if others are included if we investigate them. Yes.
So maybe Doc, you can educate us a little bit more on the high blood pressure thing. How would you randomly know that you have
High blood pressure?
Yeah.
Now let me tell you, most times patients who have high blood pressure might not know. So when they come to hospital, it might just be an incidental finding. So the doctor might just check your blood pressure and tell you, oh, you have high blood pressure. But most times when people have high blood pressure, they complain of headache, they complain of dizziness, and complain of fatigue, complain of chest pain. Yes. Those ones. Headache, dizziness, fatigue, chest pain.
And the treatments, are they usually like the same for all patients?
No, they are not all the same. There are so many classes of medications used to treat diabetes. So many. So patients, the medication will prescribe to the patients depends on so many factors. It depends on if the patients have other comorbidities. Like there are some drugs which are contraindicated in diabetic patients for treating high blood pressure. There are some drugs also if a patient has kidney failure. There are some drugs we prescribe for them. They do well on those medications. So many things, comorbidities, age, so many things they determine. And some drugs also we can prescribe for a patient. It doesn't work well. The patients are different. All patients are different. And all patients are treated in a different way. All patients are unique. That's why you can go to the hospital, you can have a problem, the doctor can prescribe the medication for you, or another person can go to the hospital, they give him the same drug, it will not work for him. So So all patients are different. So you try different medications. You can try this one, doesn't work well for the patients, you try another one. There's so many classes of medications which to treat HTM.
So I hope guys you've learned something at least. And as for Anne, have kukuja next time we do those tests that you've said.
Yeah.
They are like three or four tests.
Yeah.
She's
The
supposed to
lipid profile, blood sugar, the UECs, thyroid function tests, ECG, echo, like 6.
Yeah, she's supposed to do like 6 tests next time she comes here. So yeah, we just hope for the best, guys. And I just hope you guys learned something. And yeah, thank you, Doc,
Thank you.
for the lesson. Yeah.
But it's very important.
Nasikia kama inapatikana huko ndani.
Masikio unasikia kama nini uko ndani? Oh,
Yes.
she's saying that she feels like the ear is blocked.
Okay.
Yes.
The ear is blocked. I need to look into the ear. She might have some ear wax in the ear.
Okay.
Sometimes patients tell you the ear is blocked, they feel like some fullness in the ear.
Yeah, that's what
You
she's
need to look.
saying. Yes.
Has she been having any discharge from the ear?
Hapana.
No.
Okay.
Yes.
I need to look into the ear.
Okay.
Let me guess what's called an otoscope.
Okay.
Just to look to see what is there.
Sawa.
Apart from the ear, any other question whatsoever?
Anasema swali lingine tu yoyote.
Na kimungulilo inakuanga inanichoma sana.
Oh, she has like heartburn.
Yes.
Okay. Where is the pain?
Iko wapi? Unasikia wapi?
Tupo na kuwa na saa mwa dawa ya kimungulilo.
It used to treat acidity problem. It is called a PPI, a proton pump inhibitor. Because basically patients who have acidity issues, they have a lot of acid. Which is being released from the stomach. From a group of cells we call the parietal cells, they release a lot of acid.
Mom, haukuambia uko na shida yote ya tumbo?
Hapana, saa hii niko na mwezi mmoja lakini sijaenda hospitali.
Hiyo uchungu tu imekuwa kwa tumbo. She's been having that pain,
Okay.
so she hasn't been diagnosed by the doctor or anything.
Okay.
Yeah.
Has she been tested for H. pylori?
She hasn't done anything.
At all?
Yeah.
She has to be tested. H. pylori is a bacteria. We call it Helicobacter pylori. It is found in contaminated food and contaminated water. So if you get contaminated food or water containing that bacteria, it can get into your stomach. And it can cause those cells to release a lot of acid. And the acid will in turn burn the stomach and injure the stomach. You know acid. If acid comes in contact with any surface, you see what it does. It can eat up that surface. In the same way, it can eat up the mucous lining or the tissues in the stomach, thereby causing holes. Those holes are called ulcers or wounds, hence the name stomach ulcer. So she has to be tested for H. pylori. But she might just continue taking this medication. Meanwhile, she's not treating the underlying cause.
Yeah.
This medication is just to prevent those cells from releasing the acid. But basically, what is the cause? Because you have to treat the cause. You understand? Yes.
So mama anasema ati utatestiwa, utapimwa ujue kama uko na shida yote ya tumbo. Juu dawa inaweza kusaidia for now, but huwezi kujua kama uko na shida yote. Yeah.
She has gastritis.
Oh, she has gastritis.
When you hear gastritis comes from the word gastric. Gastric means stomach. In medicine, when you get tis, it means inflammation or injury. It's like you get conjunctivitis, inflammation of the conjunctiva in the eye, dermatitis, inflammation of the dermis of the skin, gastritis, inflammation of the stomach, arthritis, inflammation of the joints, like that. So her stomach is inflamed, and the most likely cause is hyperacidity. Okay, I want to look into her ear.
Okay,
Yes. Empieza a buscar straight. No. You can't really see anything wrong inside this ear. I'm not seeing any abnormality. I'm not seeing wax.
So what could be the problem?
What could be the problem? So many things can cause someone to have fullness in the ear. Wax can be inside the ear, cause the patient to have fullness in the ear, and ear infection. You know, when you have an ear infection, secretions can be produced inside the ear, or discharge. And those discharge also can stay in the ear and cause the patient to have fullness in the ear. Even if a patient has an ear infection, the ear canal becomes inflamed. When it becomes inflamed, it becomes swollen. When it becomes swollen, the patient can feel like the ear is full because, how will I put it? A structure has lost its normal anatomical appearance. It's now swollen. So when it becomes swollen, it becomes more bulky. The patient feels as if there's something in the ear. So many things can cause it. But I can't see wax in the ear. But the ear canal looks to be narrow. So I'm saying, I hope possibly there might be an infective process starting inside the ear. So possibly there's an infection starting. That's why it is narrow, because it's inflamed. So it is inflamed inside. So it's got swollen. Due to the fact it got swollen, the canal became narrow. You understand what I'm explaining?
I somehow get it. So she can have that treated.
Yeah, definitely she can have that treated. Give her an ear drop. It's so.
Kuna saa ingine nasikianga hii macho kama niko iko, unasikia kama ni mchanga iko ndani.
She's saying?
At times she feels like there is sand in her eyes.
Sand in her eyes? Okay. Okay. Sometimes,
Yeah.
is it every time it comes, goes?
Inakuja ikienda.
Inakuja kama wiki moja, kama siku 3 wiki. Unasikia kama ni mtu anauma mchanga anamkimbia kwa.
Okay, now when she feels that there's sand in her eyes, when she washes her eyes, or does it go, or it remains there?
Unafanya hivi.
Unafanya na kidole.
When she tries to clean it, does it go, or it remains there?
Ukifanya inatoa.
Okay.
Inatoka.
Hapana.
Inaacha.
It has not gone.
Inawacha kidogo, lakini huko ndani unasikia bado ni kama mchanga.
Okay.
It does not.
It does not go. Okay, now I'm going to ask you. For the past days, has she been having like some discharge, like mucus discharge in the morning? She sees like some discharge.
Asubuhi kuna uchafu inatoka kwa macho.
Si ni ile mtu anamkaga anakuta nini huko.
Lakini inatoka nyingi zaidi kuliko kawaida.
She has been having.
Yes.
So possibly she might have an eye infection called conjunctivitis. Because basically when you have an eye infection, the eye becomes inflamed. So when the eye becomes inflamed, when any part of the body is inflamed, more blood flows towards that area. So when the eye becomes inflamed, there are a lot of blood vessels on the eye. They become, how will I put it? They become engorged with a lot of blood. So due to those numerous blood vessels, a lot of blood within them. When she rolls her eyes, she moves her eyes. When she tries to close her eyes, her eyelids rubs on those blood vessels. So she feels as if it is sand particles. It's just her eye which is inflamed. So all the structures are swollen, so they are now more. She can, how will I put it to you? How will I explain it? It's just like, if this is a surface, and there are blood vessels here, if for any reason more blood starts flowing within these blood vessels, when you rub over the surface, you will easily feel it. Because more blood is flowing within the blood vessels. That's what's happening to her. That's why when she rolls her eyes, she feels as if there's sand in her eyes. Because the eyes are inflamed, and the blood vessels are now carrying more blood. So when she rolls her eyes, she can easily feel something. So she feels the surface of this is not smooth like before. There's some rough stuff because the eyes are inflamed. And why are they inflamed? Because of infection. And that's why she's having those discharge in the morning. She has an eye infection. You understand?
Yeah.
Yes.
So I'm thinking, do we tackle like the ear, the gastritis, and
we can tackle all of them, definitely. All of them at the same time.
we do all of them at the
Yes.
same time?
We tackle the ear issue, we tackle the gastritis issue, and the eye issue, and the eye infection.
Okay.
Yes.
So guys, ndo wanapimwa diabetes, inaitwa the sugar level.
Yeah, that's true.
Blood sugar levels. Blood sugar level levels.
So we are taking out the sugar sour, whether it is normal, whether it is low or high. So we are taking our fingerprint. gas is 14.4.
14.4. So random.
Yeah,
My blood sugar is high.
it's high.
Blood sugar is high. So random blood sugar at least should not go above 11.1.
Yeah. Okay.
11.1 around there. And fasting blood sugar should not go above 7. But now we're talking of millimoles per liter. So the blood sugar is high for today. Is she on medication for blood sugar? When last did she eat?
Mom, umekula saa ngapi? Asubuhi. Kama saa ngapi? Saa tatu. Like at 9.
At 9. Okay. Blood sugar is high. Which medication is she taking for blood sugar?
Kuna dawa unakunywa za blood sugar, za sukari?
Hiyo inakaa kama kamchele na itipepte.
Ati inaitwa aje?
Itipepte ile mnono.
850.
Kamchele.
Oh, it looks like rice.
No. Medicine, we have to be very careful what the patient is taking. The patient cannot tell you I take a medicine that looks like rice. Anything can look like rice. And you count on that and you understand me? The patients can go and tell you I'm taking.
Now we get glucophage for 5 set.
Umesema ni 5?
850 grams.
850.
Yeah.
Okay.
Glucophage.
It's metformin. Glucophage, you come in 850, but we have to be sure. We have to be very sure what she's taking. Very, very. When you are dealing with diabetic patients, be very careful. You must know what they're taking. Don't allow them to come and tell you, I take, and you start imagining what they take. Then you will start modifying their treatment based on your imagination. You can mess the patient up. Yes, because if you don't know what they're taking and you try to start gambling, you might try to adjust the medication and the patient's blood sugar will crash from you. And don't joke with low blood sugar. High blood sugar does not kill, it just causes complications. But low blood sugar, the patient will go into what you call hypoglycemic coma. You know the meaning of coma? Yes. So we have to be very careful. So I cannot look at and start adjusting. It would be good if she can bring what she's taking and I see it. Based on that, I will know how to adjust medication. You understand me? Yes. But adjusting it based on imagination, as she's saying, it looks like rice. It's going to be very difficult for me.
Okay.
You understand me? Yes.
So mom, amesema hizo dawa ile wakati mwingine utakuja ukuje na hizo dawa. Ndio kutokana na hizo dawa atajua ni nini anaweza, dawa gani nyingine anaweza ongeza ama dawa gani anaweza kuambia uache uchukue nyingine yenye iko na nguvu zaidi kuliko hiyo. Sawa? Ama uko na hizo dawa?
And with diabetic patients also, you have to work on their diets also. Very important. Very, very important. Because you can be giving someone medication to control blood sugar, but they are eating what they are not supposed to eat. So you start wondering what is happening. Why is the drug not working? You understand me?
Ilikuwa ngapi?
Ilikuwa 14.4.
Which is high.
Zinakuwa ngapi? Unapimana? Ilikuwa
Nilienda kupima. Ilikuwa 26.
26 when?
Ilikuwa sukari.
Although that's 14.4, it's not very bad. It's not bad. It's not very bad, but it's high.
26.
You understand me? 26 when?
Monday.
On Monday.
Yes.
That was very high.
Yeah.
But this one is better. This one is not very high, but it is high. You understand me? It's not very high, but it is higher than normal, higher than expected. Yes. So she has to work on her diets. Very, very important. But it's not very high, but it is high. That 26 was the one with very high. This one is high, it's not very high. Yes.
So what is left to maybe?
You collect the medication. Yeah, it's in the medication. Yes, does she have any question?
Nilikuwa nauliza hawezi kunibadilisha hiyo dawa niende na ile anajua ni nzuri, iwe na kunywa siku yenye matanisaidia nikuja.
So,
She said, if you can change the medication, you don't want to next week.
okay.
But now the issue is, You don't know the route.
I don't know what she's taking. Do you know what we do? When next she comes back, let her come back with the medication she's taking. I want to see it. Yes.
Sasa,
Because we might not need to change the medication. We can maintain the medication.
kuna hiyo kadawa yenyewe ama karatasi yake.
Hapana, siko nyumbani.
Siko nyumbani.
Sasa,
siku yenye unakuja utakuja nayo ndio daktari anaangalie. Sasa kama atarudisha nyingine atakuwa amejua ni kani na tumia.
So, as I was saying, we might not necessarily need to change the medication. We can just increase the dose or the dosage. Dose means 500 milligrams, 400 milligrams, 200 milligrams. That is dose. Dosage means once a day, twice a day, or 3 times a day. So we might not necessarily need to change the drug. We might just adjust the dose or the dosage, or both the dose and the dosage. You understand me?
Swali lingine mama.
Hapana. Ya, tu bwana niambie tu.
I'll give you medication.
Utapewa dawa ya tumbo na ya masikio na ya macho.
Oh, Felicity, any question?
No question.
No question. Okay.
You want to take the test?
So guys, that is it for this video. I hope you guys have learned a few things, and mama amesaidika pia. She's okay now. Tuta revisit Komarok Modern Healthcare once again, afanyiwe those tests and tuone progress yake. But for today guys, thank you so much for tuning in. I'll see you in the next video. And we also want to thank Komarok Modern Healthcare, of course, because of course wame to take through all this, and yeah, make sure guys you visit also, and you'll get the best